So many patients often ask me, what are the symptoms of obstructive sleep apnea? So to talk about the nighttime symptoms, when people have sleep apnea, they can often snore or snore loudly at night. They can have pausing of breathing that can happen at night, which is something that usually it's the spouse that will bring up. Restless sleep, tossing and turning in the middle of the night, or they may simply remember that they're waking up often in the middle of the night as well. Sometimes they use the restroom. And a common thing to look out for is, are you using the restroom more at night than when you're awake during the day? Another thing that can happen in the middle of the night if someone has obstructive sleep apnea is that the mouth can open in the middle of the night as part of an emergency response of the brain when the brain doesn't think it's getting enough air. But the problem is the mouth is not designed to breathe. So if the mouth is open, all that air rushing in and out of the mouth can cause significant dryness of mouth. And sometimes people will have a glass of water by their bedside and they'll take sips throughout the middle of the night, or they can simply wake up in the morning with a significantly dry mouth. And one last symptom that people can have in the middle of the night is that they're noticing that they're sweating more than they should be based on the temperature of the room. So a list of symptoms to look out for those who may have obstructive sleep apnea is to watch for how you wake up in the morning. If you're waking up with a dry mouth or a sore throat, drooling, morning headache, or you're simply exhausted despite feeling you've slept enough in the middle of the night, these are common symptoms to look out for when you're waking up in the morning. And to now talk about the daytime symptoms, some of the symptoms are obvious that you can notice anytime you have a bad night of sleep. A mental fog, decreased memory or attention, in addition to the obvious things such as sleepiness or tiredness, which are slightly different things. Some people will notice that they're more anxious during the day, and that's another thing to look out for. Some other daytime symptoms people can have when they have obstructive sleep apnea has to do with mood. We've all experienced when we have a bad or short night of sleep that our mood changes and can change during the day. People can be more irritable, they can have a more depressed mood, and these are common daytime symptoms as well of obstructive sleep apnea. And of course, one thing to realize is that not everyone with sleep apnea will have all of these symptoms. In fact, one thing to remember is that some people with sleep apnea may not even have snoring.